So our next presentation is actually going to be the burden of asthma in Florida overview from our wonderful colleague, Dr. Wanda Rodríguez-Donham, who is our Florida Asthma Program Manager, has got quite a bit of history with the program at this point, and is just an absolutely passionate and ardent champion of people with asthma in Florida and of diversity in asthma management. Remember also, if you're just joining us, that if you're seeking CHES credits, you must fill out the standalone PDF CHES credit evaluation form. That is different from the general evaluation surveys for both the summit and yesterday's mini course. For anybody who attended that, invitations for those evaluation surveys, the ones that are not for credit, will go out early next week directly from SurveyMonkey. You'll get email invitations. So if you're seeking those CHES credits, there's one other thing you got to fill out. It's a fillable PDF. It's accessible from the event website. Any questions can be directed to our Altus representatives using the event chat on the event page, or the contact information for them, which is in the view guidelines area. So with that, I am going to give Dr. Donham the floor.
Good morning, everyone, and thank you. Thank you for being here with us with the Florida Asthma Coalition. Like Dr. Navagaski said, I am Wanda Rodríguez-Donham. I am the Asthma Program Manager for the great state of Florida for the Department of Health. And I'll be talking today about Florida updates on asthma and other things that we have been doing. So I'm going to share my screen. Let's see. Okay. Let's see. Oops. Okay. Sorry about that. I thought I had it ready.
Wanda, if you would like me to pull up the slides, and you
Yes,
can
please, because I'm having a little technical difficulty here. Thank you, Ted. Okay, so again, sorry about that. We're going to give the okay. Okay, so presentation overview will be, we will talk about the Florida Asthma Program, past, present, and future, the exhale strategies. But at this point, I think everybody knows what the exhale strategies are, the asthma home visiting program, and the lessons learned, burden of asthma, Florida asthma profile, and the data resources. As we know already, the Florida Asthma Program coordinates statewide efforts to reduce asthma disparities and hospitalization rates. Next slide. Next slide. Okay. And increase the management for education. The FAP is funded by the Centers of Disease Control Prevention. And in 2019, the program was awarded the Comprehensive Public Health Approach in Asthma Control through Evidence-Based Interventions. Grant cycle is from 2019 to 2024, and we are about to enter year 4 of this grant cycle in September. Next slide. So at this point, like I said before, we have we go by the Exhale guidelines, and the Florida Asthma Program and the Florida Asthma Coalition, we work toward visiting every letter of these acronyms. Next slide. So our major area that we work because of the pandemic, like everybody else, was deeply impacted by this. So we have the Florida Asthma Home Visiting Program. The eligibility criteria is to qualify for the program is ages 5 to 18 diagnosed with asthma. We also accept adults too. Have an asthma control test of 19 or below. One of the or more of the even ED visits or hospitalizations in 6 months. We accept referrals from physician hospitals, clinics, schools, and the participating counties are Miami-Dade, Orange, Seminole, and Gadsden. And we do this visits either virtually, in person, or in a hybrid mode. Next slide. So in the Florida Home Visiting Program, what we have learned, we have started taking data, obtaining data about from December 2020 until April. And we have noticed, like almost everybody else, that we have seen improved asthma control, fewer asthma symptoms, reduced missed days in school and work, reduced use of unscheduled visits for emergency department, urgent clinics, and hospitalizations. Next slide. And this is just a little snippet of what we have encountered with these visits in the 4 counties that we have continued to do the Florida Home Visiting Program. And all the statistics are still being generated. I don't have a lot of data, but so far we can see that the asthma control test, the ACT, has gone down. Has gone up prior to the intervention and obviously after the intervention, and ED visits. We have seen also reduction of hospitalizations, but the data is not there yet. So just looking at the very general on ED visits, we have seen a reduction of 87% on ED visits with the Florida Home Visiting Program. And so I am going to thank wholeheartedly to my asthma coordinators in the 4 counties, because they have poured themselves into this program. And you will meet them a little later, but I'm going to mention them by name. Sandra Echeverri Barona from Miami-Dade, Dr. Annette Thomas from Orange County, Enid Santiago from Seminole County, and Dale Harrison for Gadsden County. So thank you guys, and all the people that work with them. Next slide. So the preliminary data indicates that the Asthma Home Visiting Program is having a positive effect in the program participants. And these are some of the feedbacks from the parents. So basically everybody that the parents that are exposed to this intervention at home, either virtually or in person, they're seeing the difference. They're feeling confident about watching asthma symptoms and trigger reduction, trigger control, asthma medication adherence, and knowing what's the difference between a controlled medication or a quick relief medication or rescue medication, and not identifying them by color. So that's one of the things that we have seen. So children and participants are being kept in school, sleeping better, so, and being active because of this program. Next slide. So we are seeing what numerous studies are out there that visiting program improve asthma control, reduce ED or emergency department utilization, and cost and improve health quality. So these are some of the studies. There's plenty of them out there. Almost every of the programs, the CDC funded programs, can tell, and we have seen each other thrive in this department because of the home visiting program. Next slide. So we have the asthma-friendly schools that we have tried very hard to do this. But with the pandemic, even though the schools here in Florida have been open since August 2020, there's restrictions and anybody outside the staff and the students coming to schools, but it's opening up, and we have actually one of the schools in Miami, actually 8 schools in Miami-Dade County that are going to be offering virtual asthma self-management programs. So we have the asthma friendly schools recognition program, and so we, depending on the criteria, people the schools can achieve bronze, silver, gold, platinum status. Next slide. So we also have the air quality flag program. It's also part of the asthma friendly school program, where we offer the schools and community organizations the opportunity to learn about the relationship between the environment and health. And if you're anybody is interested in participating, please communicate with the Florida Asthma Coalition at floridaasthmacoalition@gmail.com, and we will send you a free air quality flag kit that includes 5 flags. Next slide. And also, before I forget, and I just forget, please ensure about your outdoor environment. And like days like we're having in Florida these days, like where we have the heat index in the upper, well, the low hundreds, obviously. Look for those triggers like high ozone and high particulate matters in there. So download the airnow.gov app so you can be alerted about the air quality outside. And open airways for schools and kicking asthma. These are we continue to offer these evidence-based asthma management courses for children grades 3 to 10 from the American Lung Association. And so those 8 schools in Miami-Dade County, they're going to go through these courses again during the summer, like I said before. Next slide. So the burden of asthma in Florida. Multiple sources of data are used to provide a comprehensive picture of the burden of asthma in Florida. They're population-based surveys like the Behavioral Risk Factor Surveillance System, the Florida Youth Tobacco Survey, and the Asthma Callback Survey. And also we have mandatory reported health information like from the ED and hospitals discharge data, transition from ICD-9 to ICD-10, asthma code now is J45, previously was 493. And we have also vital statistic mortality data in here. Next slide. So as we know, lifetime asthma is just has a doctor, nurse, or other health professional, care professional has ever told that you have asthma. And current asthma is that you still have asthma. Next slide. So I'm going to go through this next slide very rapidly because I'm running kind of out of time. But we have the data is up to 2020, and I'm going to give a shout out to my fabulous epi team, Dr. Rodríguez, Pierre, and Kathleen or Kate Karsmiski, that they're always giving me and providing me with this data and help me understand this. But in 2020, so we've seen just a little bit increase, but not as much. And obviously everybody is going to be very, I guess, eager to wait what the 2021 data comes back after the pandemic. Next slide. So the asthma prevalence by gender in 2020, you can see the males and females. I mean, females have a little bit more asthma as we age, as we know that women have more prevalence of asthma than males, and childhood is the opposite. Next slide. Okay, in 2020, the prevalence of lifetime asthma, it continues to grow a little bit, depending basically on race and ethnicity. In the non-Hispanic, Black and Hispanic, there's always more prevalence based on the race and ethnicity. Next slide. Florida adult lifetime and current asthma prevalence just diminishing a little bit, but and probably we're expecting to continue to diminish even during the pandemic. Next slide. And currently we sit at 13%, 13.4% for females, and lifetime and current 9.4. So again, we see that women have more prevalence of asthma than males in adulthood. Next slide. And the age group, the 45 to 64, has just slightly higher, but it seems like it's almost the same across the board. Next slide. We see the same thing in here. Non-Hispanic, Black and Hispanics having current asthma prevalence. Next slide. And then here in Florida, you see the education level and the household income. It's just almost the same on the education level, and the household income. We have more people with less than $25,000 a year. Next slide. Asthma adjusted ED visit rate per 10,000 population, it's going down, and it as we have coming out of the pandemic, we have seen several variables or factors about this diminishing the ED visits, and so we know that people were scared about going to the emergency department in the middle of the pandemic. There were several reasons: fear, they were confused, there were mixed messages, they could not get appointments at the doctor's office because everything was closed. So there's several factors about this. So it will be very interesting to see the 2021 and 2022 data when it comes out. Next slide. So we see the same thing. The non-Hispanic Blacks have the highest incidence of ED visits than anybody else. Next slide. And again, the ED visits are higher among children from 0 to 4 years old, and it starts diminishing, but it's still going, and we still well below of the Healthy People 2020 target. We can't do 2030 targets because obviously we don't have the data for this point. Next slide. Age-specific ED visit rates. So children, and then once adulthood starts, 2024 years, it's kind of peaks there and then it starts declining. Next slide. The asthma age-adjusted hospitalization rates also going down, but again, this is pre-pandemic. Next slide. The hospitalizations, again, higher on children. Next slide. And again, if you see, obviously, children 5 to 9 years is a little higher, and then it goes as people get older, 35 to 65, it starts increasing the hospitalization rates. Next slide. The asthma-adjusted death rate, it increased slightly, 2020. Next slide. And an average 19 people died of asthma per month. Is still way too high. So we're that's part of our goals in here to increase quality control, asthma control, I'm sorry. And also obviously to decrease mortality and prevent unnecessary death. Next slide.
So it's 8:45. We are going to have to transition into our next presentation at this point in time. I want to thank Donham for that terrific presentation. Slides from